it becomes next to impossible to try to get reasonably priced health insurance or health insurance at all. If reform is done right, it should increase your choices, not limit your choices. If I thought any bill was going to limit the health care and insurance choices of the citizens and families of our district, that'd be an easy vote for me. I'd vote no.
Ladies and gentlemen, the next person to ask a question is Ben Martinez from the Johnson County side of Burleson. The person who will ask a question after Ben, the person's from Tarrant County, so we're going to go for another question. Another person will be Jim Olmsted from Godley. So Ben, go ahead, and then Jim Olmsted from Godley.
Ben is my brother. He's just really shy. Congressman, we wanted to know, why doesn't President Obama just do a national vote and keep Acorn and the Black Panthers out of the stations, the voting stations?
Acorn and Black Panthers are not two organizations that I follow closely. While we're here to talk about health care, Jacob Stewart, who's on my staff, sitting next to you, if you would give him your name and your phone number and how we can get back with you, and let me know your specific question and concerns about Acorn. I've heard some say that Acorn wrote this law, or some other group wrote this law. Acorn didn't write this law. Can you be a little more specific about what you want done vis-a-vis Acorn and Black Panthers? Please, so I can hear the question.
The question was having a national voting on this health care plan.
There are a lot of people in this room, I know everyone in this room reveres the Constitution. The Constitution has established a republic, a democracy, and we're following the rules of that Constitution. And I respect the process of that Constitution. Is it imperfect? Absolutely. But I think it's the best form of democracy in the history of the country. If you want to change the Constitution so that it based on national referendums, then it would require a constitutional amendment, 2/3 vote in the House, 2/3 vote in the Senate. I will tell you this. You got to be careful how you do initiatives and referendum, because that's something California passed a number of years ago, and I don't necessarily want our country or our state to emulate California.
Jim Olmsted, are you Jim right here? We need a microphone down to Jim so he can ask the next question. Our next person to ask after Jim will be Harlan McLemore from Hillsborough.
Yes, sir, Congressman. I'm skeptical that the government cannot be capable of running a health care program. Can you name me 3 government programs that work as intended and within budget?
Jim, I can share with you a long list of programs where, I don't think the government has done nearly the job it should do in running programs. But let me specifically answer that question. It's not the government's role to make a profit, but I will say this. While I will not be an apologist for all government programs, I think we have the finest national defense in the history of the world. I chair the Veterans Administration Appropriations Subcommittee. and we have a VA healthcare system run by the government that provides quality healthcare to 6 million veterans. I don't want to try to take that special model for veterans and apply it to all Americans, and that's why I oppose a Canadian-style healthcare plan. But let me ask you this question, Jim, if I could, so that I do understand where you're coming from. I think Medicare and Medicaid and Social Security are three of the most important programs that the government has ever passed in law. In the lives of senior citizens and American families. Would you go so far as to say we ought to take the government completely out of health care? I take that by your standing, the chance and the yes. Let me tell you, and it looked to me like a little more than half of the audience stood up. Let me tell you why I disagree with you on this. I respect your position, but I want to tell you, and I'll be clear why I disagree with you. If you got rid of the Medicare program and the Medicaid program, you would shut every private and nonprofit hospital in our congressional district and most hospitals throughout the United States. And Medicare and Medicaid perfect? No. But I will tell you this, the Medicaid program, for every dollar in taxes you spend in Medicare, 95 cents goes to direct medical care for senior citizens. If you take the top 10 largest publicly held health insurance companies in America, they spend 23 cents of every dollar you pay in premiums on overhead, and only 77 cents goes to direct medical care. So, and I would respectfully say to you, well, and I'm grateful we can live in a country where we can differ. I would respectfully suggest to you that those of you who would want to abolish Medicare and Medicaid are not reflecting the values of the vast majority of people in this congressional district. And the final point I'd make, by the way, the Medicaid program not only provides maternal health, so low-income families can have healthy babies, but 2 out of every senior citizens in the state of Texas getting quality care in a nursing home is there under the Medicaid program. So to get rid of Medicare and Medicaid, not harm seniors, harm families, and will put at risk, at great risk, the quality of our public-private health care system today.
Ladies and gentlemen, the next question will be asked by Harlan McLemore of Hillsborough. After Harlan, we will hear from Rosemary Busk of Granbury. Mr. McLemore.
Yes, no one has congratulated you being on a short list for Vice President. I guess that's one of the perks for voting for Pelosi 96% of the time. My question to the government, Amtrak, the stimulus bill, and Freddie Mac, any of the programs that the government gets into, cash for funders, none of them work. And the deficit's supposed to be at $7 million a couple of weeks ago. Now they said it's off, and it's $9 million now. How much will it be?
Last fall, a year ago, this month, President Bush came to me and other members of Congress and said, and to the country, and said, we're at risk of falling into a second Great Depression. The world markets have frozen. Businesses are not going to be able to borrow the money they need to make their payrolls and grow and expand their businesses. The stock market was starting to drop dramatically, and there were 2 choices. Some